Nursing 2080 Pharmacology Clinical Case Study. My patient's name is VW. My patient is a patient that is an 85-year-old white female with a history of multiple medical problems, including COPD, coronary artery disease, hypertension, atherosclerotic heart disease, GERD, overactive bladder, hypothyroidism, and unspecified mood disorder. Patient is alert and orient to person, place, and time. Resident does have a history of dementia, but is not currently on medications to treat dementia. But patient is able to make her needs known. Daughter is currently at the bedside, and due to patient's inability to independently participate alone with the plan of care and this particular clinical case study, the patient does have the daughter at the bedside. Patient's daughter is her medical power of attorney and advocate and is fully knowledgeable of the patient's new and old medical history, along with providing accurate information in regards to her mother's medication and compliance. As addressed with the patient and daughter, either of their names will be used during this case study to ensure that the patient's individualized confidentiality will be maintained and protected. List of medications. Patient is currently taking ranitidine, Zantac, 150 milligrams, 1 POQ day, which is considered an H2 receptor antagonist. The action is competitively inhibits action of histamine at H2 receptor sites of parietal cells, decreasing gastric acid secretions. Use to treat gastroesophageal reflux disease. Side effects: headache, vertigo, blurred vision, abdominal pain. Nursing implications would include: assess the patient for abdominal pain. Note the presence of blood in stool or emesis. Instruct the patient on proper use. Instruct the patient to use or take the medication at bedtime for best results. Instruct patient to take without food. Instruct patient to not drink alcohol and avoid cigarettes, because this may increase gastric acid secretions, and advise the patient to report abdominal pain, blood in stools or emesis or coffee ground emesis to the provider immediately. Carvedilol, Coreg, 3.125 milligrams, 1 POBID, which is an alpha non-selective beta blocker. Action: non-selective beta blocker with alpha blocking activity. Use: hypertension, left ventricular dysfunction post-MI, mild to severe heart failure. Side effects: dizziness, fatigue, headache, bradycardia, thrombocytopenia, hyperkalemia, and hypoglycemia. Nursing implications would be to educate the patient not to interrupt or stop the drug without medical approval. Inform the patient that improvement of heart failure symptoms usually takes up to several weeks of the drug therapy. Advise the patient to contact the doctor if he or she has weight gain or shortness of breath. Capsules should not be crushed or chewed. Take the drug with food. Next is isosorbide dinitrate, which is isosorbide, 10 milligrams, 1 PO Q day. This is considered a nitrate. Action is to reduce cardiac oxygen demand by decreasing preload and afterload. May also increase blood flow through the collateral coronary vessels. Use: acute angina attacks to prevent situations that may cause anginal attacks. Prevention of varicose rebleeding in combination with a beta adrenergic blocker. Side effects: headache, dizziness, orthostatic hypotension, nausea, and vomiting. Nursing implications would include to monitor the patient's blood pressure and heart rate. Caution patient to take drug regularly as prescribed and to keep it accessible at all times. Advise patient that stopping the drug abruptly may cause spasms of the coronary arteries with increased angina systems. Caution patient to avoid alcohol because it may worsen low blood pressure effects. Next is furosemide, Lasix, 20 milligrams, 1 PO Q day, which is considered a loop diuretic. Action is to inhibit sodium and chloride reabsorption at the proximal and distal tubules and the ascending loop of Henle. Use: acute pulmonary edema and hypertension. Side effects include headache, hypokalemia, hypocalcemia, hypomagnesemia, nausea, vomiting, vertigo. Nursing implications would be to monitor the patient's weight, blood pressure, and pulse. Take the rate routinely. Monitor patient closely because this drug is a potent diuretic and can cause severe diuresis with water and electrolyte depletion. Monitor fluid intake and output. Electrolytes, lab as such as BUN, and carbon dioxide levels. Watch for signs of hypokalemia such as muscle weakness and cramps. Consult a dietitian about a high protein diet or protein supplements. Foods rich in protein include citrus fruits, tomatoes, bananas, dates, and apricots. Monitor glucose levels. This particular medication may cause GI upset, so advise the patient to take the drug with food to prevent GI upset. Take the drug in the morning to prevent natriuria. Instruct patient to stand slowly to prevent dizziness. Teach the patient to avoid direct sunlight because the risk of photosensitivity. Next is levothyroxine, Synthroid, 112 micrograms, 1 PO Q day, which is considered a thyroid hormone. Its action is to stimulate metabolism of all body tissues by accelerating rate of cellular oxidation. Use: thyroid hormone replacement, hypothyroidism, and severe, long-standing hypothyroidism. Side effects include headache, fatigue, tachycardia, diarrhea, menstrual irregularities, weight loss, and hair loss. Nursing implications would include to monitor the patient with diabetes because they may need to be on an increase of their insulin in this particular type of medication due to its anti-diabetic doses effect. Patients taking anticoagulants may need their dosage modified and carefully monitored as well. Make sure that the patient understands that replacement therapy is usually for life. Teach the patient the importance of taking the medication without skipping a dose. Warn the patient, especially elderly, to notify prescriber immediately of chest pain, palpitations, or shortness of breath. Advise the patient to protect tablets from direct light and moisture. Advise patient who has achieved stable response not to change brands of this medication. Advise patient to never stop the medication without consulting their prescriber. Next is oxybutynin chloride, which is oxybutynin chloride ER 5 milligrams 1 PO Q day. This is considered an anti-muscarinic, and the action is to relax smooth muscles of the bladder by antagonizing muscarinic receptors, relieving symptoms of overactive bladder. Use is for overactive bladder. Side effects include dizziness, headache, constipation, tachycardia, urinary hesitation, and urinary retention. Nursing implications would be to warn the patient about hazardous activities such as operating machinery or driving until CNS effects of the drug are known. Advise the patient to avoid alcohol while taking this drug. Tell the patient the drug may cause dry mouth, and advise the patient to use caution in hot weather. Next is venlafaxine HCl, Effexor XR 37.5 milligrams 1 PO Q day. It's considered an antidepressant, an SSNRI. Action may increase the amount of norepinephrine, serotonin, or both in the central nervous system by blocking their reuptake by the presynaptic neuron. Use is depression, generalized anxiety disorder, panic disorder, and social anxiety disorder. Side effects include asthenia, headache, dizziness, insomnia, hypertension, tachycardia, vasodilation, blurred vision, hyponatremia, and weight loss. Nursing implications would be to warn families or close family members to closely monitor the patient for signs of worsening conditions or suicidal ideations. Warn the patient to avoid hazardous activities that requires alertness. Teach the patient to recognize and immediately report signs and symptoms of serotonin toxicity, such as fever, mental status changes, muscle twitching, loss of coordination, and diarrhea. Take each dose with food and a full glass of water. Patient is currently also taking vitamins, which is a supplement, just multivitamin 1 PO Q day, and its use is to encounter for prophylactic measures. After review of medication list with home health list and the pharmacy medication list as well, patient and daughter verbalize that the patient is in adherence with ordered medications and medical recommendations. There were no discrepancies observed during checking the medication list, and the home health, as stated per the daughter, has provided a list of medications that coincide with the recommendations and plan of care. Daughter verbalized also that she has been taught and there is current teaching done thoroughly by the home health agency. Patient verbalized the importance and understanding of taking all medications as ordered. After conducting a thorough medication reconciliation, I did identify 3 priorities for safety concerns. Number 1, the patient did have several old bottles of medication in a cabinet that the daughter stated that she was just keeping. Number 2, the patient had 2 different prescribers noted and was asked if both providers knew what each was prescribing for the patient, and they were unable to tell me if both providers were aware of all the patient's medications or not. Home health, which is number 3, fills a medication planner each week for the patient, but noted that the patient and the daughter, what would happen if home health was unable to fill the planner? Are they fully educated enough to fill the planner themselves, which can cause safety issues? Then there were 3 related instructions that I basically taught the patient to ensure her safety. That would include that the patient and daughter be instructed and discarded the medication in the other cabinet due to the risk of possibly mixing the wrong medications. Number 2, I educated both the patient and the daughter to ensure that both providers have an updated medication list and to follow up with her home health agency to ensure that they do a follow-up as well with the provider so that there would not be any medication errors. And number 3, I assisted the daughter in contacting the home health to ensure that they are thoroughly taught how and when to fill the medication planner each week in the event that the home health is not available. Thank you.